So I'm so happy to welcome everyone here to Career Force's Explore Careers in Healthcare series. This January, we are exploring all of the different opportunities that the healthcare world has to offer. This first one will focus on transferable skills. How do you identify the skills that you might have had in another industry? And how do you get that into hold on, let me get my sharing here again. How do you get that back into the healthcare industry? There. Does everyone see the screen again? The slides, hopefully. Always a little glitch in something. I'm so happy today to have a number of guests and partners, colleagues from the Career Force system and other areas. We will hear from Jenna Kellerman, who is a Director of Workforce Strategy for Leading Age of Minnesota. We have Samantha Moore from Acumen. We have Julia Grotner from Crestview Senior Communities. And I have two colleagues from Career Force, Jessica Miller, a workforce strategy consultant from the Southwest, South Central Minnesota area, and Tom Reese, an employer representative job counselor from Career Force Bloomington, who has specialized in the healthcare industry for many years. So I welcome all of you here today. I'm going to turn right over to Jessica Miller and have her get us started.
Thanks, Liz. So as Liz mentioned, I'm a workforce strategy consultant covering Southern Minnesota. We are so excited that Governor Walz has signed a proclamation to designate the entire month of January as Healthcare Month. And as a state, we'll be spending time focusing on healthcare careers during the month of January. We'll focus on a variety of jobs that are available in healthcare, the opportunities for free training and education, and the long-term employment outlook, as well as just how easy it is to get started. We'll also be taking time to celebrate our healthcare workers and providers for all that they've done to care for and support our families. So thank you for having me, Liz. I'd also like to have a big welcome and thank you to all of you out there joining us in a discussion on how skills developed and perfected while working in many other industries transfer perfectly into a new career in healthcare. You can go to the next slide. There we go. So if you're currently seeking employment, you will want to consider a career in healthcare. Maybe your job has been recently impacted by COVID-19, or maybe you're looking to make a change in your career path, or maybe you just have a passion for people and are a natural caregiver. Regardless of where you are in your career journey, our healthcare industry really needs you. Next. Healthcare is seeking compassionate and caring people to fill a multitude of positions, both patient-facing and non-patient-facing. There are a variety of open positions in the healthcare sector, and you likely have a set of skills that can easily be transferred to help meet those needs. And that's good news. This means that you already have the skills needed to get started. Add that to the on-the-job training and education opportunities, and you'll likely be ready to jump into your new career as soon as tomorrow. We've put together a list of 7 skills needed for healthcare employers right now. And we'd like to talk through those 7 skills to kind of show you how the skill sets that you probably have from other jobs and how they work directly into healthcare positions. Number 1 would be focusing on the customer. In many industries, it's extremely important to zero in on your customers' needs and wants quickly. You're used to ensuring that your customers are happy and feel cared for, and then ushering them through to make room for your next customer. The same really holds true in the healthcare industry. Healthcare employers need employees who can assess the needs of their patients by asking the right questions while building rapport and making them as happy and comfortable as possible. Number 2, attention to detail. You know the specific requests of your customers and exactly how they like things done. And you've learned to ask the questions to uncover those details that your customers probably wouldn't even think about telling you. You know that missing one of these details can affect your customer's entire experience, and in some cases could possibly be life-threatening, as in the case of like food allergies if you have been in the service industry. This is an extremely important skill set for every position in healthcare as well. Tracking those details and maintaining proper documentation is an important part of any position in healthcare, and someone with those skills already in place is of great value to employers. Number 3 would be multitasking. You've probably are used to managing many things at once, and depending on your position, you know how to handle customer needs on the phone, by email, and face-to-face, often simultaneously and with an eye to balancing multiple people's interests and needs. And you do this with a smile on your face. Healthcare employers also rely on strong multitasking skills and are often serving more than one patient at a time, people with differing needs, and a variety of variables that impact their ability to communicate those needs. Someone who is adept at taking care of what needs to be done with a positive attitude is invaluable to any organization. Number 4, team focus. So you are probably already very well aware of the importance of everyone understanding their role and how it impacts the person next to them. You're committed to collaboration and often share in the rewards of success. So I think about the servers who share their tips with everyone on the team, from the host to the person washing the dishes. The same holds true for those in healthcare. It takes a team of professionals to ensure a positive patient experience, from the person who writes the prescriptions to the person who administers the medication, all the way to the person who brings the hot lunch and ensures that the bedding is clean and fresh. Number 5, relationship building. You know the importance of a hello and what it means to someone to remember their name and their favorite place to sit, maybe. You have customers who will wait all day to work with you because they know you and they trust that you'll take care of them the way that they want to be taken care of. You know this because you've learned the art of listening and the importance of paying attention to the small details. The healthcare industry thrives on people who have this skill set. A foundation of patient care is establishing a relationship of trust and connection. This is a skill that cannot always be taught and is so important to the quality of care, especially when working in long-term care facilities. Number 7, conflict resolution is a big one. The good news is that you're already used to navigating the art of working with all kinds of people. You've seen it all, you've done it all, and you've probably cleaned it all up. You've developed the skill of managing your emotions and de-escalating the emotions of others, and you're able to compromise and offer solutions. These are skills that those in healthcare positions use every single day, and someone who can remain calm while serving in this capacity is in very high demand. I think we missed one slide. There we go. Sorry, you can go back to this one. Yeah. So finally, the last one we've pulled out is a strong work ethic, number 7. You've put in 16-hour days on your feet, and sometimes without breaks, and sometimes without knowing ahead of time that you were going to put in those 16-hour days. You put all your effort into ensuring that those you're serving are enjoying their activity, having a nice warm meal, and creating memories with their family and friends. And you do this because it's important to you and you care about your customer. Next. So you will find many healthcare job openings that may entail on-site training, but don't require certification or state licensure. And among them are home care aides, resident aides, direct support specialists, as well as jobs in medical coding and billing, food service, and housekeeping. And you can see on this graphic, I don't know how large it is on your device that you might be viewing this, but there are a variety of different careers. And again, not all of them are patient facing. So if you're worried about a blood thing, then you've got other opportunities to serve in this capacity. The main thing from healthcare providers that I've spoken to is just that ability to care for other people, a passion for people, and a passion for caring and being of service to others. And if you've got those qualities, those are really what it takes to be successful in a career in healthcare. The training and the education component can be brought in later, and oftentimes you can move up in that career path for very little expenses of your own. A lot of these providers do have educational opportunities just by working there. Next. So what kind of work were you doing, and what kind of work would you be interested in doing now? So check out this new tool, and it will help identify some potential jobs that you could be applying for. So in the green boxes at the top, it will show you jobs that you may have experience in already. So waitresses and waiters, for example, bartenders, cooks, restaurant dishwashers. So are those careers that you've been in already? Then you can look at the boxes in orange. We'll show you some potential jobs that you could be applying for that could be a good fit for you based on your skill set, along with the educational requirements to do those jobs. So for example, there are the top tier, all are high school or less, and then it goes into more training, vocational training and associate's degrees. Depending on what you're looking for. And like I said, to get in the door, a lot of these providers will provide that training for you on the job. And, you know, if you're not quite sure where to start, and you know that you have a drive to work with people and you care about people, you should be sure to check out our skills match tool on the DEED website, where you can search for a job that might be a good match based on your work experience. So you can type in words and it'll pop up different career opportunities. And I think that Liz might be covering that later on. And then finally, the last slide I have. Really need you most right now. If you are interested in putting those skills to use by pursuing a career in healthcare, you can visit the job search page here on careerforcemn.com to find opportunities that are available to you right now in your own backyard. I guarantee there's something close that's available to you. You can also check out our virtual and interactive services. And as always, feel free to reach out to your local career force location for one-on-one assistance should you want to speak with one of our career counselors. So that's the slides, the information I have to share for you. If you have questions, pop them in the chat and I can answer them. But in the meantime, I'm going to introduce you to Jenna Kellerman, who is the Director of Workforce Solutions at Leading Age.
Hi, everyone. Thanks for having me here today. I'm excited to talk with you and take a deeper dive into long-term care as one of your healthcare career options. So first, just to give you a little background on me, I'm Jenna Kellerman. I'm the Director of Workforce Solutions at Leading Age Minnesota. Leading Age Minnesota is one of the 2 trade associations for long-term care in our state. So as a trade association, we work with what we call provider members. So those are nursing homes, assisted livings, home care, adult day services, hospice, those types of organizations. And we work with them by providing different education opportunities, continuing ed credits. We offer advocacy and regulatory assistance. We offer technical assistance. So, for example, if a nursing home has a clinical practice question, they can give our experts a call and get help. So that's the type of service we provide. And so we work really closely with nursing homes and assisted livings. This is a really fun presentation and a really fun topic for me because prior to working with Leading Age, I worked in the provider setting. I worked in nursing homes and assisted livings, and that was a career transition for me. My education and background and first jobs were in public relations, and I pretty quickly discovered I really didn't like that work. But it ended up transitioning into long-term care because there are marketing positions in long-term care. And so I used my skills in a different area, applied them in the long-term care setting, and then took off on a whole different career that has been really, really rewarding. So I hope with this presentation, you can kind of see a similar path for yourself and see where some of your skills might transfer into this field. So if you want to switch to the next slide. So long-term care is a huge field and a little bit complicated. So I just want to give a little description so you can maybe better visualize what your role might be. there are lots of different settings under the term long-term care. So nursing homes, assisted livings, home care, adult day, hospice. Any of those settings might be really huge. They might be part of a large health system. So for example, Ebenezer Care Centers are a part of the Fairview Health System. So Fairview is huge. They have hospitals, clinics, pharmacies, but they also have long-term care organizations. Some are really small, right? There can be assisted livings that are a house with 4 bedrooms and 4 residents living there. So they can be any size. They can be for-profit. They can be nonprofit. They can have staffing structures where you're a member of an interdisciplinary team. So maybe you're a caregiver and you're working with people in dietary and in working in a pharmacy and working in housekeeping. Or maybe you're a home care worker going into someone's individual home and you're working primarily alone. Probably still as part of a care team in terms of support and hopping on the phone and working with people in that way. But in the actual care being provided, you might be independent. So there's all different staffing structures. There's different organizational structures. Each of the organizations provide a different level of care. So some are really, like in the senior apartment example, people living there might be very independent, living in their own apartments and really not needing much in terms of help from staff, versus a nursing home where people might be receiving 24-hour care of pretty high level clinical need. We call that high acuity. So there's just lots of variables. And so as the staff member, you kind of get to choose what type of environment you find most exciting and work in that environment. But despite that, they all have that same mission of wanting to provide quality care, provide well-trained, passionate team members who can help and take care of older adults. So they all have that in common. If you want to go to the next slide. So from my experience in working in long-term care, it's kind of like a town within a town. And this is going to vary, again, depending on the size of the organization. But a lot of these organizations, especially nursing homes and assisted livings, they might have a store. They might have their own pharmacy or a coffee shop. They might have a dining room. They might even have multiple restaurants. They might have their own clinics or salons where you can get your nails done and hair done. So they can kind of be like a town within a town. And so when you think about it that way, really any previous job experience you have just in your own community is probably applicable in some way in a long-term care organization because of that town type setup. So if you want to switch to the next slide. So here's kind of my attempt to help you visualize where your specific background and skills might apply into a position in our field. So if you have background working in a restaurant, or maybe you're a really great home cook and you just enjoy it and you love it and you've always been interested in it as a career but never got formal training, or maybe you're a stay-at-home parent and you do a lot of cooking and you like it, consider a job in one of our culinary departments. They do operate very similarly to restaurants. And so whether you have your ServSafe certification or not, we have a home for you in long-term care. So if you have some of that training, great. If you don't, then we provide that. So if you go to that next square down, it's that white square that talks about hotels, hospitality, events. There's all kinds of jobs, I think, that have a nice transferability into our field. So I'm just going to explain a couple of these. I think caregiving is a little clearer, and housekeeping and being a receptionist, those maybe are a little bit clearer if you've had those roles in the past. Resident services, though, I want to go into a little bit. So resident services often is a care coordination type role. And oftentimes this role is in an assisted living type environment or senior apartment type environment. And so it's a type of role where you'd be connecting residents to different services they might need. So for example, if someone moves in and they need housekeeping, as the resident services coordinator, you might help them figure out, okay, well, what day do you want them to come? What do you need them to do? How often do you need them to come to your apartment? And then you help in coordinating that schedule. So that's a lot of coordination. marketing, I talked about earlier in my own example, if you have a background in marketing or sales or customer service or graphic design, many of these organizations have marketing or communications departments. And so a lot of those skills might transfer very directly into our field. Activities is one I want to touch on as well, because that's a really fun role. And I think a lot of careers transition into that type of role well. So if you work in the activities department, you're kind of the cruise director or the event planner. That's the group of people who are planning card games, organizing book clubs. In non-COVID times, they're taking people to restaurants or to plays or to parks around the city, or out on walks or whatever it is. They're planning the events and kind of helping guide people through them. It's a really fun role. They do happy hours, they do parties. So if you have that kind of events, hospitality type background, that's a great position to look into. I'll also mention that caregivers often have a really wide variety of tasks in their job. So it might be anything from helping someone walk from their apartment to a dining room or an event. It might be providing more clinical services. If you're working in an assisted living, for example, you might be passing medications. But they also often are helping with events and doing all those fun things with residents too. So just know that there's a lot of variety in these jobs, and any of that type of customer service event type role, like the previous presenter talked about, a lot of those transition really directly into the long-term care field. So if you take a peek at that top right square, again, I mentioned caregiving and activities in this area. I think there are really clear connections if you have a background in education or childcare, because again, a lot of that is kind of event planning, ushering people through, helping people learn, helping people engage. And that's, I think, a lot of what happens in education settings also happens in our long-term care settings. And then in that bottom right square, I just listed mechanical type work, building operations, facilities, groundskeeping, security. All of those types of roles are often within our organizations in long-term care as well. They all have complex buildings to keep running and operating. Often it might be a little more complicated because we're in healthcare and it's a heavily regulated field. But again, we provide the training on site. So it's a great way to grow your skills and continue boosting your resume by taking a job in one of our settings and getting that additional training. So if you want to move on to my final slide. So I would just encourage you, if this is an opportunity for you to start new, maybe you've had a career in a different field, it's a great time to take a look at long-term care. Again, a lot of your skills or previous positions probably transfer really well into long-term care. And it's a fun field. We provide on-site training. We often pay people for that training. There's lots of scholarships and loan repayment opportunities that are unique to long-term care. So, for example, if you begin working as a caregiver in our field, most organizations will pay for you if you want to get on the nursing assistant registry. We'll pay for that training. If you want to become a trained medication aide, we'll pay for that training. There are loan repayment programs. If you recently started school to become an LPN, for example, there are loan repayment opportunities for you in our field. So it's just a great chance to give it a shot because we have those resources to help you do it. And just as a really great example, for anyone who's on this call considering a career change, in my previous role, I had a staff member who was a resident assistant. So that's a caregiver who doesn't have any formal training. She was just trained on the job. She was fantastic, and I thought she'd be a great nursing assistant. So I encouraged her to go back, get her certification to become a nursing assistant. We paid for her to do that. And she was about 55 years old. She went back and did it, and she was really hesitant about going back to school, but she did it. She loved it and was so engaged and empowered by that experience. She pretty much immediately said, okay, I want to keep going. I want to become a trained medication aide. So we paid for her to do that. And then after that, I left that organization, but I connected with her later, and she was looking at LPN schools. And so it's just such a fantastic example. It doesn't matter if you're 55, it doesn't matter if you're 18, it doesn't matter if you've already retired and you're looking at coming back. There are so many opportunities, and it's never too late to learn something new and try something new. So hopefully long-term care is an interest and can become a passion of yours like it is for me. So were we going to stop for questions now?
Hi, yes.
Yeah, I'm happy to take any questions or.
Well, one clarification, someone was asking, is the caringcareerstarthere.com through the state of Minnesota? And I can say no to that. Jenna, why don't you talk a little bit more about that?
Sure, yeah. So Caring Careers Start Here is a collaborative effort. There's a lot of organizations involved with that, but it's mainly operated by Health Force Minnesota, and that's a center of excellence in the state system. And so when you go to that website, there's a couple different purposes. One is to help guide students into careers in long-term care, but there's also a link kind of at the top of that web page that brings you to a survey. So if you're interested in careers in long-term care and you don't really know where to start, but you're interested in kind of finding opportunities near you, you can click on that link and just fill out a survey. It basically just collects like your name, the area of the state you live in, and then gives you an opportunity to click check boxes of where your interests are and whether or not you have certifications. And then you submit it. And magically, through the power of the internet, we get that information and we start connecting you with employers near you who might be great matches for you. So again, it doesn't matter if you have certifications or not. It's just our way of saying, hey, this person is interested in working in culinary or housekeeping or nursing, and we can help connect you to people in your area.
Great, thank you. Yeah, and there was one other question a few minutes ago from someone who said she's foreign educated as a nurse and she's passed her NCLEX RN exam. So perhaps filling in that Caring Career Start Here would be a good thing for her because she was looking for someone to get connected with, how to get a healthcare career next.
Sure. Yeah, if she's licensed in Minnesota, there are so many organizations hiring. I'd be happy if she wanted to email me too to connect. I think Nicole Matson from Care Providers, I think is also on this call. She could connect with either of us, and we'd be happy to connect her with organizations nearby too.
Great, thank you. Well, let's move ahead. We've got two facilities, two people that actually do hire on the call, and I want to make sure we have enough time for everyone. I'd like to introduce Samantha Moore of Acumen. Samantha, it's all yours.
Awesome. Thank you. Thank you so much for having me. Hello, everyone. Happy afternoon. My name is Samantha Moore, and I'm a talent acquisition partner for Acumen. Acumen is a Minnesota-based senior living company here. If you want to go to the next slide. We're the one of the nation's largest senior housing providers. So we have assisted livings, we have independent livings, we have home and hospice care. We have our nursing location, our nursing home locations, our skilled nursing facilities all across Minnesota. We're formed back in 1862. Again, like I said, we're based in Minnesota. Our support service office is out of Shoreview, Minnesota. And we have just a national reputation for innovation. We look at technology, looking at continuing to improve our team members and our residents' lives who live with us. And we center everything around our residents. And again, just providing the best care that we can for them each and every day. And then, of course, our team members who provide that care. I'm going to go ahead and go to the next slide. So here's all of our locations. And so we've made a couple of changes here in 2021, but we are, as you can see, highly involved in Minnesota there. We do venture out into some other states as well. And again, all of our services do vary by different towns. So an example is Mankato. We have a skilled nursing facility there. We have a new independent living that is opening actually in a couple months. We have assisted living and memory care within that region. So we hire all across Minnesota, like I said. If you want to go to the next slide. So kind of our values What is Acumen values? So we honor, we treat people with dignity and respect, both our team members and the ones that we care for. Innovate, we find new ways to exceed people's expectations. We empower people, we encourage them to dream and take action and bring those new ideas forward. We serve, we put people at the heart of what we do. And again, the residents are really the heart of what we do. That's how we serve them and care for them, and looking for people who have that passion as well. We're going to go to the next slide. So we've won a couple of awards for being the best place to work and one of Minnesota's top workplaces. And the reason why we've been named that is by our own current team members. So they survey our current team members that work for us in all different locations and across, and we've been able to win those awards because of that. And the reason why I bring that up is because, again, we truly do put our team members and residents at the core of what we do as a business. Go ahead and go to the next slide. So what you'll find at Acumen, I know both Jessica and Jenna talked a lot about different things that you can bring into opportunity or what the companies offer, especially in long-term or how one of those things is job stability. You know, we're in senior housing. There's estimated around 10,000 baby boomers that are retiring that will need homes. So we're continuing to advance that. There'll be continuing to be a need into our future. We offer career advancement opportunities from within Acumen. So if you start out in dining or you start out as a resident assistant where you don't need a certification, but you want to obtain that certification, we offer those type of advancement opportunities and additional education opportunities, again, to continue to move forward with your career. We hire a variety of different people with diverse and different backgrounds from age, gender, sexual orientation. We're very, very open to anyone and everyone as long as they have a passion for taking care of others. We have a sense of mission and purpose. And of course, we offer a great benefits package for most of our positions. Next slide, please. So who we hire. So this is just a short list of who we hire. So we do hire nurses, RNs, LPNs, those certified nursing assistants, which are in those skilled nursing facilities. However, I do want to just kind of call out, we do provide CNA classes, and we do help pay for the classes and the testing out as well for those CNAs. And then we do have some sponsorship and scholarship opportunities, of course, within Acumen as well. And our resident assistants really help in our assisted living, and those do not require CNA certification at all. But again, we highly encourage if anyone, applies and joins Acumen and is really interested in obtaining that, we do provide those opportunities as well. Our life enrichment, which is really that activities area that Jenna had mentioned too. Anyone who's interested in creating fun different activities to do with our residents, different things. Of course, right now we are a little bit more hesitant just with COVID, but we're hoping that there will be days past that as well, that we can get back to a little bit more of our normal day-to-day. We do offer occupational therapy, physical therapists, dining, so cooks, serving our residents meals, cleaning up. We, of course, housekeeping and maintenance. One other thing, too, that's not on this list that we often hire for are receptionists and administrative assistants. And again, really, as long as you have a passion for caring for others and are really customer service focused and really thinking about our residents' needs, we can train you on all the other things that you may need to have or may want in your future career. Next, there we go. And again, just kind of talking again, re-highlighting, passion to serve as caregivers. We're really looking for passionate people who really have a drive and wanting to do and make the best day for anyone. Again, making a difference in someone's life and then providing that high quality and innovative care. So just to kind of wrap it all up, so senior services careers are growing, as both Jessica and Jenna had mentioned as well. Working with older adults is important and very fulfilling. We have a lot to learn from our older generation. They bring in a lot of amazing knowledge and advice and great stories. You can grow and advance your career at Acumen. Through a lot of variety different ways. Again, we are located across Minnesota and into some other states as well. And just our last slide. So, of of course, we have openings right now. So the best thing, we have a texting feature, so you can text Acumen to 97211, or you can visit our acumen.org/careers today, or you can email us at jobs@acumen.org. So a lot of different ways to get a hold of one of us if you have questions or want to know how to get started. And I see that there's some questions coming in.
Yeah, one question was, how do we reach the hiring manager in the Mankato, Minnesota region?
Yeah, so I will actually type in my email here as well. So I actually support Mankato, so I will just have you just email me, and I'd be happy to connect you and talk further about what we have open there.
Good. And then the other question was, what backgrounds do you look for in resident assistants, and are there current openings in the Twin Cities?
Yeah, so resident assistants usually fall within our assisted living communities. And so really, again, what we're looking for in that background is just someone who is very passionate about caregiving, because they are those direct care positions. So helping a resident, take a shower or bath, get dressed, undressed. We do medication passing in that role, which we do full training on. So really just having that passion for caregiving, and we'll do all the other training for you. And yes, we do have openings in the Twin Cities location. And again, the best way is to go to acumen.org/careers. You can search by location in there, or you can text the word Acumen to 97211, and it'll ask you for a location specifically and give you the full list of what we have open there.
Great, thank you.
Yeah, I also just want to call out one more thing too for any students that are out there in high school or even in college. We do a lot of flexible scheduling for those individuals who want to get that experience. So in the healthcare, or maybe they're in a nursing career or healthcare career, there's a lot of opportunities there as well.
Great. Yeah, the next week's session is all going to be about training and education and how to get started no matter what age. So I love all the talk too today about how everyone is willing to train people into the industry. Thank you so much, Samantha, for being on the call today. Samantha can continue to answer your questions in the chat. And now I'm going to introduce Julia Grotner of Crestview Senior Communities to join us.
Thanks, Liz. Hi, everyone. As Liz just said, my name is Julia Grotner, and I am the Senior Campus Administrator for Crestview Senior Communities. If you want to go to the next slide, perfect. So Crestview Senior Communities has been serving the North Metro Twin Cities community for over 65 years. We are a faith-based nonprofit organization. We do have two campuses, one in Columbia Heights, which is very central metro, just north of Minneapolis and along bus lines, as well as our Blaine campus, which is just a little bit north. At Crestview, we have over 300 employees that are part of our organization between both campuses, and those 300 employees serve a capacity of about 500 residents who live with us in all of our different types of settings. Next slide. So Crestview offers a wide range of types of service. I know Jenna Kellerman had kind of gone over some of the different types of services within long-term care, and Crestview does offer a wide range among the continuum, from skilled nursing to assisted living to home care to senior housing. So when those that are a part of our Crestview team are able to serve residents throughout kind of a wide variety of ranges, and a lot of our staff do have the opportunity to kind of float through different areas of our community and follow people throughout the years of their life. Next slide. So when people think of healthcare, oftentimes, especially when I've spoken with high school classes and just career exploration classes, I think a lot of times people think of nursing when they think of long-term care and senior services. But I always like to point out that there are a wide variety of career options in the industry, as we are businesses ourselves. So even if someone doesn't have an interest in nursing and maybe gets grossed out by some of the things that comes with nursing, there's still a wide variety of ways to join the industry in a career that can be so meaningful. And I did also try to, for this slide, kind of put it in a way that shows some of the potential career ladders within this field as well, because I think it's so important that even as someone's starting at a base level, to also show where the possibilities may be and how they can expand their careers. And so this also, the second slide just kind of keeps going. So there's, as I said, a wide variety beyond nursing that are offered. Information technology, one example of kind of a career ladder or career change that happened within our own organization for that is one of our maintenance guys ended up having a love for IT and has recently switched into an IT coordinator for us. So kind of started with just a maintenance job, went to school for IT, and we were able to transition him because as long-term care companies, we do offer a wide variety of opportunities. Next slide. And so I did just kind of want to highlight some internal examples of what we have since this webinar and presentation was about changing careers and career ladders. So one prime example I have is one of our culinary supervisors used to work in the restaurant industry as a cook at a variety of restaurants, ended up becoming the culinary supervisor to open our Blaine campus with us, and fell in love with the industry. He was still able to use his talents as a cook, but I know one of the things that he especially liked with this industry is just a little bit more stable hours. He wasn't having to work the very late night shift in the restaurant industry and was able to have a little bit more work-life balance with his family. Another example is one of our receptionists. She worked the front desk and got to have so much interaction with the residents and help them with a wide range of things that she fell in love with working with them and is looking into social work programs so that she can continue to have an impact on residents' lives and also work in a more intimate setting with them. Life enrichment assistant, I've got two examples of these. Joined our team from just kind of straight out of high school and fell in love with the industry so much that she's now pursuing a career in healthcare administration. Another one of our life enrichment assistants came to us, was previously a personal trainer with a kinesiology degree, and has been able to transfer that into a life enrichment assistant position where he's able to still use his degree and lead exercise and different kind of workout programs for our seniors. So there's a wide variety of ways that skills are so transferable, and I think sometimes it's just jumping into something new and also finding where your new passion is and where a better fit may be. At Crestview, we love with new employees kind of exploring where their hidden skills or talents may be, and then matching those to different careers or positions with the organization and different career ladder opportunities. And we're always encouraging people to go back to school to pursue those opportunities or take different classes through the Career Force Center to really encourage them to do those positions and find their passion and where their hidden talents and skills truly are. Next slide. So amid this world of COVID, we are still hiring. It has made us kind of adapt to the world that we're in. While we are still doing in-person interviews, a lot of our interviews now take place over the telephone or through Zoom so that we can be virtually available to people wherever they are. And then just one other thing that I like to point out now, because I think with healthcare sometimes I get the question, is it safe to work there? What about COVID? So within healthcare, and I know this is common for basically all organizations within long-term care, we're doing start-of-shift health screenings. We have personal protective equipment for our staff. We are doing COVID testing, and most recently, we are able to offer the COVID vaccine to our staff and residents to continue to protect them and keep them safe. And next slide. And so this is my final slide. It does have how you can find our open positions and also who at Crestview you can reach out to. I'll also throw my email in the chat box in case anyone wants to personally reach out to me. I'm happy then to connect you with whoever may be appropriate, or happy to even just answer some more questions that way as well. So Liz, are there any questions in the chat box for me?
Yes, one question that came through, is regarding healthcare administration. If you do go into administration, is it necessary to have a previous experience in healthcare?
So yes and no. It kind of depends on the position. For example, if you go into administration in a nursing home, it is required to have a certification of a licensed nursing home administrator. Within assisted living and housing with services, there's not currently a requirement to have a certain type of certification or things like that. However, there will be a certification that will be coming up here in about the next 6 months or so. But with that, people are able to get kind of trained a little bit on the job to get that type of certification. So I know realtors will be housing managers or sales managers. I've seen people switch from nursing to that. Business administration, there's a wide, especially in the assisted living world, there's a wide variety of backgrounds for housing administrators or assisted living administrators.
Thank you. Another question coming in: are there medical coding positions in like the senior care community?
Yes, I know between kind of yes, there's a variety of terms that companies will use for what those positions kind of are. I know every company kind of has different names for them. But yes, there are within long-term care communities. I think most often you'll find those within nursing homes.
Sure. Another question, are the Crestview and Acumen job opportunities on careerforcemn.com? And yes, I'm going to be going over that in just a minute. They're on minnesotaworks.net. One last question, then we'll wrap it up for this section. What has changed in the healthcare field in the last 2 years? One person has tried to find work in the field and even took a medical terminology course in hopes of getting a care coordinator position, but didn't have any luck, even though that person has a degree and some great work experience. What advice can you give to that kind of situation?
I don't know if I can answer what's changed in the last 2 years, but I guess my advice, especially right now, just kind of knowing how the workforce is right now for this industry, would be to apply again. I know there are tons of career opportunities within healthcare and long-term care right now, in many companies that are looking and searching hard for candidates right now. So I can't, quite say maybe why those opportunities didn't come to fruition within the last 2 years, but I would, just knowing where the workforce is at, strongly encourage you to continue applying right now, because I know there's a great need in our industry for a lot of positions.
Thank you, Julia. And thank you for being here and representing Crestview Senior Community, crestvviewcares.org. I love that URL. So thank you. We're going to move on, and in the next 10 minutes, just cover a few things that Career Force can help you on. And this can go to that career seeker's question, that there's a team of job counselors throughout the state who can help you navigate some of those things if you're getting stuck in finding position. This first page, I just want to point out that on the careerforcemn.com page, on the home page, as you scroll down towards the middle 2/3 of the page, there's a green bar that goes across, and it's called Explore Careers. And all of you career changers, job seekers, as you're trying to find out more information about any position, where are you going to go? Go to Explore Careers. So scroll down, get to the green bar. In this example, I typed in dietary. On the left-hand side, it's the dietary, and then on the right-hand side, I showed you a screenshot of the results, part of the result that it gave me. You can there select a region that you're in, and it will focus the information. It talks a little bit about the daily work activities for someone who works in the dietary industry. It talks about the demand. This information is pulled directly from the labor market Data Information Center from DEED. So that's a great resource. Talks a little bit about the education, whether you need a high school diploma or a 2-year program or what next. So I do encourage all of you to use that. The next thing I wanted to point out too, one of the benefits of working with a job counselor is really understanding your personality and what you're good at. Maybe you have a great handle on it, or maybe you're trying to go through a career change. You want to kind of just refine a little bit what you're really into. You know, to put it slang. You know, what are you into? So there's something called the Holland Code, and I just put a screenshot up here. You know, are you artistic? Do you like to create things? Are you social? Do you like to help others? Are you enterprising? Maybe like starting businesses, or conventional? Are you an organizer, or realistic? Are you an active doer? That's one of the resources of many that you can access on careerforcemn.com/assessments. But then I'm going to transfer you over to Tom Reese. And Tom, why don't you jump in right here? Well, how can a job counselor in the Career Force system help you use this information?
Absolutely. Thanks, Liz. Good afternoon, everyone. In response to Liz's question, I think it's a huge advantage for people on this call to connect with your local Career Force location, talk to a staff person there about how you get connected to some of the great employers we heard from this afternoon, as well as the associations. Wonderful offers that were made to all of you regarding their availability. One of the things that we emphasize at Career Force is informational discussions with employers. So really would encourage all of you to reach out to your local Career Force location. The expectation is for all of us here as staff to be able to connect you with the local employers. So if you reach out to us and you were to say, you know, I'm interested in a specific position, or at least learning more about it, how can I connect with people that can actually share that information with me? We are there to do that for you. That is what we consider to be a basic responsibility to the citizens of Minnesota. So please consider doing that. The other comment I would make, all the presenters indicated to you this afternoon that healthcare starts with what's simply referred to as a service heart. So if you're able to deliver a personality, a desire, a passion around helping others, and serving others. Healthcare providers will take care of the rest, so to speak. So it's a wonderful time to go into healthcare. I like to say there are endless opportunities regardless of what you're looking for, but don't be afraid to ask people for advice as to how to determine what is the best fit for you by going out to employers and talking to them. The other comment I'd like to make here is to be sure that you set up an account and post your resume on minnesotaworks.net. You see the website at the top of the page there. When you're job searching, for those of you who are not familiar with Minnesota Works, you're certainly able to search within a geographic location based on your zip code, as indicated on the screen there. You can also do a keyword search. So there's many ways to discover opportunities within minnesotaworks.net. And along with that, I would also look at the job descriptions listed on that website. It gives you a chance to see how the skills that employer is looking for match up with your abilities. It's kind of a bit of a job screening device if you look at it that way. So I encourage you to register in Minnesota Works, look at the job opportunities, the locations, the kinds of opportunities that are available there, but then absolutely plan to reach out to that employer and talk to them prior to applying. I'm willing to say today to all of you that employers out there in the healthcare space are waiting for you, that they're more than happy to talk with you about their industry and how proud they are about it or with it, and that your skills, regardless of where you're coming from, will match well and transfer nicely into healthcare. There's the direct care positions, and then there's the support positions. So depending on, as one of the presenters said, whether you're able to handle the not such fun parts of direct care services or not, that's up to you. But both are available. And Liz and I are here today to encourage you to take a good, serious look at healthcare with the opportunities that present themselves in our labor market today. Thanks, Liz.
Yeah, no problem. We had one question here. Is there a department at the state that we can check out an organization before we apply for positions with them? I don't know exactly what you mean by that question, though that's part of the reason why we've held these Explore Careers and all in 2020. I and many of my colleagues in Career Force held the virtual career fair. So I do want to point out that the virtual career fair webinars have all been recorded for the entire 2020 since March through December, and they're available on YouTube on careerforcesmn.com. All of the companies are in the comments field, so you can listen to a 10-minute conversation with that company just to get a feel of what the recruiter was saying about what they were hiring for. We have 2 minutes left, so I just want to go ahead and follow up here. Many of our colleagues across the metro especially, and I know all of the locations throughout the state of Minnesota, will be having job fairs all month. These are 3 of them in the metro that are specifically healthcare hiring focused. January 13th in Anoka County, January 20th in Hennepin County, and January 26th in the afternoon for the entire metro region. So you'll be hearing more information about that. You can always reach out to me for that information too. Please go to careerforcemn.com/industry/healthcare. If one of my colleagues would be able to put that in the chat while I talk, that'd be great. But that has all of the information about the job fairs and everything else that is planned around the healthcare focused month. And then please come back next week and the weeks after, January 12th, 19th, and the 26th. Next week, we will be talking with more companies about education and training opportunities, how they pay for your education, depending on what you want to do within the healthcare industry. January 19th, we'll be talking about on-the-job training, apprenticeships, and then January 26th, career pathways. What does it really look like? If you, like, I love that story Julia was talking about, the maintenance person who went over to decided to start working in the IT services. What a fantastic career path that is. So those are the 3 upcoming conversations. I would love to have you back and bring some of your friends. So please contact me and Tom Rees, both at the state of Minnesota. The emails are on the last slide. Contact our Career Force Help Desk and any of the speakers today, Jessica Miller, Julia Grotner, Samantha Moore, and Jenna Kellerman, and Tom Rees. Thank you all for being on the Explore Careers today. See you next week.